I want to talk to you about why you should not do therapy with an abuser and the abuser's victim. So, in other words, couple therapy typically. When you find out there's abuse in the relationship, why should you not continue with the therapy or not continue with counseling? If you are a coach seeing the couple together, if you are a mentor couple that is counseling couples, if you are a ministry leader, a pastor, once you recognize or identify that there is abuse, should you keep seeing this couple together? And that is typically what people do, is they think, okay, well, I see this, it might be abuse or it is abuse, but I'm gonna keep seeing this couple together. But it has quite a few pitfalls, and I want to talk to you about what those are. Well, the first one is that therapy is supposed to be a safe space for everyone. And when you are in therapy and you are maintaining a safe space, you typically do not judge or align with one couple or one person of the couple. And by saying basically in your safe space where you're neutral, you don't typically say to the abuser, the problems are caused by you. We're going to focus on you. We're not going to focus on the other person. We're just going to focus on you because you are abusive. We typically don't do that. What we do is we maintain a neutral stance. We maintain the thought that both of you are at fault. Both of you have problems. Both of you are going to be listened to and taken at your word. Both of you are going to get a chance to complain. Both of you are going to be believed. When you do that in a session or in a relationship with a victim of abuse, you hurt the victim. You do what Annette Altman's calls double abuse. You abuse the person further by not validating their pain and validating the abuse. You minimize the importance of the abuse. So having that whole attitude of what you're doing normally when you're counseling a couple is having a neutral, safe space and assigning problems to both of them is damaging. The next one is vulnerability. When you're asking an abuse victim to be vulnerable in a session, in a counseling session or a meeting with the abuser, you're forgetting something. That vulnerability is going to backfire on the victim. That abuser is going to take that out on the victim. They're going to be angry. They're going to punish. There's going to be a fight when they leave. There's going to be repercussions. That's going to be thrown at the victim and used against the victim. So this is dangerous. To expect or to ask an abuse victim to be vulnerable in a room with the abuser is really not good. The next one is assigning co-responsibility for marital problems, which validates the abuser's perceptions. I think I kind of alluded to that when I was explaining the first one about the safe, neutral space. But I just wanted to say that again to make it very clear that when you are assigning that co-responsibility, you are basically agreeing with that abuser. Yes, this is her fault. This is the victim's fault, or this is his fault. There is a reason why I abuse, and I abuse because this person isn't perfect, or this other person, the victim, causes me to do that. And so it is harmful. The next one is that it's very easy to get sidetracked with details of complaints and overlooking patterns. So you might, again, you might allow an abuser to spend the whole time complaining about things that the victim has done. And it's very easy to get bogged down in those details and not recognize and get to the point where you actually point out, I'm sorry, this is abusive. This is not okay. So by allowing this person to go on and on and on about those details, the whole time that these are being stated, and you're listening and nodding and hearing and maybe asking questions, the victim is sitting there and saying, oh my gosh, the abuser is saying things that I supposedly did that I didn't do, or blaming me for things that I'm only doing because I'm like, totally traumatized because of the abuse. And you're listening as though those are valid. And again, by getting bogged down with all those details, you're hurting the victim. The next one is listening to the abuser's false accusations, because abusers will make actual false accusations and accuse the victim of doing things that the victim didn't do. And the abuser might say, well, it's cheating on me, or is chronically complaining, or is crazy, or is, doesn't do the things that I'm asking to be done. Whatever they are, they're false accusations, and you're listening to them because you're, again, coming from that stance where you have to hear what this person has to say, and here the victim has to sit there and listen to another person agree with validity of the abuser's false accusations. The next one is that validating the abuser's feelings or beliefs further traumatize the victim. So the victim is hearing you validate what the abuser is saying that is felt or experienced, and the victim is thinking, these things are part of the abuse, and these things are crazy. These things aren't even real, or this person is mad at me because I'm not automatically complying with demands that are crazy. So whatever it is that's being said, by validating it, you are traumatizing the victim further. The next one is by overlooking abuse passively as opposed to confronting it outwardly, actually colludes with the abuser. So you're actually saying to the abuser, yeah, you're telling me that you're abusive. I'm going on as if you're not abusive. That is not passive. It is actually colluding with the abuser. It feels passive to you, but it is not. It is overlooking something that is very damaging. And by doing that, you, in the victim's viewpoint, are colluding with the abuser and not siding with the victim. And in abuse, you must side with and protect the victim. And you have to do that by calling out the abuse and by confronting the abuse. The next one is allowing the abuser to use covert emotionally abusive tactics on the therapist will traumatize the victim. And what I mean by that is the abuser is going to be manipulative with the therapist or the pastor or the minister or the other couple, maybe gaslighting, maybe minimizing, maybe doing things that will cause you to question or discounting things. And so allowing those to work and having the victim see that those things are working is, again, traumatizing the victim, because the victim, once again, feels very powerless, feels like in this session, I'm trying to get this person who I see as my rescuer, the person that might be able to help me. And remember, the victim is desperate and in a lot of pain and feels very powerless. I'm hoping that this person will rescue me. And instead, I'm sitting here and I'm seeing the abuser actually take control and power over this person that I was hoping to be my rescuer. And now I feel really hopeless, because the abuser, and this happens a lot with narcissistic people, who literally can charm the therapist or the pastor or the person and get that person to believe them over the victim that is being abused by the narcissist, and actually get that person to side with them, but by using all of their covert tactics that can manipulate and pressure and get that therapist or to side with them. And then the next one is that the abuser is emboldened to continue the abuse by seeing the abuser in couples therapy, and by listening to both sides. The abuser's thinking, I'm the same as the victim. I've got legitimate claims here. And the abuser is not softened by that. The abuser is emboldened by that. Like, somebody else agrees with me that the victim is wrong, that, my wife isn't perfect, that my wife doesn't listen to me, that my wife doesn't submit to me. So these, or my child is rebellious, or my child isn't obedient. So whatever it is, or that my parent is just, just needs to be honored, whatever it is, basically, the abuser is emboldened when somebody listens to it and continues as if it's not a problem and does not call it out and gives support to the victim to help that victim gain some power back against the abuser, then the abuser is emboldened. The next one is the victim is re-traumatized. So any of this that's going on is literally re-traumatizing and hurting a victim. And if you know how much pain a victim of abuse is in, recognizing that you're actually causing more pain and hurting that victim will hopefully cause you to want to become more able to respond appropriately to abuse when you see it, and to recognize it, to support victims. Next one is the hesitancy to use labels to describe behavior patterns. So therapists, pastors, people, they don't like to tell people, oh, you're narcissistic or you are an abuser. So the hesitancy to do that, to say, I'm recognizing abuse here, you are an abuser, it takes a lot for people to get to that point. And because of that, seeing a couple together where there is abuse, knowing that that's a really high bar for you to get to where you would actually call out abuse, means that you're going to be reluctant to do it, because nobody likes to do that and wants to do that. And then there's always a fear in couples therapy, because remember, we're talking about the pitfalls of couples therapy when abuse is present in a couple. The fear of alienating the abuser by confronting the abuse, because therapists, pastors, any person that is trying to help a couple, they don't want to alienate one of the two of the couple. They want both of them to be willing to continue in therapy and to continue listening and to continue coming. So they're not going to want to say strong things to the abuser and point out to the abuser, that's abusive, that's not okay, or to side very clearly with the victim over the abuser, because they're going to be fearful. If I do that, he's not going to come back, then he's not going to get help, then he's not going to continue to be open maybe to me telling him things. So you're not going to confront it, and there are other ways to do this. You can confront the abuse. I see abuse here. This is a clear abusive pattern. By confronting it honestly and saying it, even if you don't fix it and you don't change it and the abuser doesn't come back, at least you have empowered the victim. At least you haven't empowered the abuser. You haven't validated the abuser. You haven't emboldened the abuser. You've validated the victim, which is going to empower the victim. You can continue seeing the victim. You can help the victim become stronger against the abuse, to set boundaries against it, to refuse to continue to tolerate it, to require that the abuser get into therapy and make changes. You can stop seeing both of them and send them both to appropriate help, or you can continue seeing the victim, or you can tell the victim, you need help, you're abusive to the abuser, and I'll continue working with you, but only if we confront the abuse, as long as you're trained to do that, because it's not easy to deal with abusers and to get change in an abuser. So you've got to be willing to do that. You've got to be willing to confront it. You've got to be willing to validate the victim and not validate the abuser. So what are some benefits of confronting the abuse? Well, the abuser, without a faulty belief system, will change. Sometimes you'll have abuse where somebody's abusing or acting in abusive ways and has abusive behaviors in a relationship, not recognizing that they're abusers, maybe just doing what the dad did or doing what the mom did and not knowing that's abuse. And yet, when you tell this person your behavior is abusive, you're doing what your dad did, what you saw your mom do, or what you saw your mom do to your dad, but that's not okay behavior. For somebody who doesn't have entrenched belief systems that support the abusive behavior, they'll change. They'll be appalled. They'll be like, are you kidding? I don't want to be abusive. I don't want to treat my wife that way. If you get the abuser's attention that doesn't have those really faulty belief systems that are so resistant to change, you'll get change. So you have then actually made significant impact in this relationship. The abuser is directed to some type of individual therapy that will focus on the abuse to possibly get change. The victim is validated, as I said, and the victim can go get appropriate help, which will actually support the victim, and hopefully the abuse will stop. So if you want to make an impact with couples that have abuse in their relationship, the abuse must be confronted. Therapy for an abuse victim has got to validate over and over and over again that the behavior that is being experienced is abusive, because abuse victims will doubt themselves and the abuser blames the victim, and abuse victims will go right back to that place of doubting, that place of self-doubt, that place of self-question, that place of feeling responsible for the abuse. So abuse victims have to be validated and educated about what abuse is and what the abuse tactics are. They've got to be helped to set enforceable boundaries. And there's a whole lot of work that can be done with the abuse victim in order to help the victim. Okay, so I hope this has helped you. It's basically the pitfalls of doing couples therapy when abuse is present in the relationship. I hope I've convinced you. And again, I would recommend that you seek out the MEND Project. MEND Project, themendproject.com, founded by Annette Altmans, who deals with this even in more depth and helps get you trained to deal effectively with abuse victims. So thank you for watching. And if you want to know more about my ministry, Change My Relationship, I hope that you will go to my website and check out my studies and my resources. God bless.